We have Mike Kanarellis. He's the assurance manager for Wolf & Company. And he's responsible for managing a team of healthcare services security professionals. We also have Paul Zawinski. He's a sales engineer for Citrix and has been working for cybersecurity and other areas since 1998. Gentlemen, it's all yours.
Thank you.
This is the friends and family session.
The after lunch session.
So I can kind of do a little bit of background about myself. Again, I'm Mike Kanarellis. I work for Wolf & Company. We're a public accounting firm based in Boston, and I run our healthcare IT security practice. So over the past 10, 15 years, I've been lucky enough to do some very large HIPAA security audits at some of the largest healthcare providers throughout New England, where we're looking at the HIPAA security standards. We're doing external, internal wireless penetration testing. We also do very, very in-depth application pen testing on patient portals and any type of application that's web-facing where there's obviously greater risk to patient information. Also perform very large social engineering engagements, which is the fun part of my job, where we send in phishing emails and call folks on the phone, try to get username, password information. We'll go into hospitals unannounced, put on lab coats, walk out with computers on wheels. Yeah, so it's all in the effort to improve an organization's overall security posture. And one of the pain points that I've seen, especially over the last 5 years, as our audits have intensified, is vendor management, and that's what we're going to be concentrating on today. And it's really relevant for both sides of the fence. For covered entities, you need to be very aware of the due diligence activities around your vendor mix. You need to know what type of documents to be asking for as you're signing up vendors, especially with the move over the past 5 years to cloud vendors. A lot of folks, a lot of your vendors are holding protected health information. And it's your data. It's your patient's data, but ultimately you own that data. You want to switch it to your presentation?
Is that computer that you're dealing with up there from 1983 or something?
It's not mine.
No, not your computer. I mean the one from the hotel.
Yeah. Circular.
So it is from 1983.
Circular over that counter.
So on the covered entity side, with your HIPAA requirements, business associate agreements aren't enough any longer. So you simply can't have your vendors sign a BAA and just wash your hands with it. There are other activities that you need to be doing from a risk perspective, from a security perspective, and from an overall governance perspective. On the flip side, for the business associates in the audience, if you're housing PHI, the demands on the compliance documents that you need to produce is increasing exponentially. So, and I'll get into a few of the more specifics from a high level. We're talking about business continuity, disaster recovery documents. If you're selling into a hospital, they're going to want to know what happens to my data, what happens to our business if you go away, if a tornado hits. We need to know what your backup procedures are going to be to make sure that the data that we need is going to be available. And also from the covered entity side, who within the organization you're dealing with from your vendors is going to be responsible for producing those documents. So we certainly will kind of get down into that. And I'm going to speak specifically about one document that there's still some confusion about, and that's a SOC 2 audit, Service Organizational Control Audit. Used to be called a SAS 70, as the kids like to say, back in the day. And thankfully, it's been broken out and is a much more valuable report that hospitals can use to give them assurance about the security and availability of their information. I'm just going to continue. So, from a covered entity side, what we want to see is a very mature vendor risk process. We want to see a complete inventory of your vendors, and that's the easiest exercise of all. I mean, we talk about risk assessments, and yes, I would like to see having threat discussions about each vendor, talking about external threats, internal threats, and then creating an inherent and residual risk score. But at a very minimum, I like to see, when I go into institutions, at least an inventory of your vendors. Who are they? Who are you doing business with? And what is the relationship dynamic, and what information are they housing? And based on that information, let's rate them high, moderate, and low, and then tie in due diligence requirements based on that rating. So your EMR vendor, high risk, they're housing literally the keys to the castle for a covered entity. They're housing the most sensitive data that you have. So in terms of vendor risk assessment, they're going to be rated high. And that's where you want to see all of the documents, all of the compliance documents. You want to make sure that the contractual language that they're signing is including very specific items. And if they don't have it, it's a huge red flag. And my recommendation to a lot of hospitals that I do business with is, if they can't produce these documents, move away. That is a big X that really should help inform your due diligence process as you're doing a vendor selection. And then it has to be a continual monitoring of that. It can't be just a 3-day exercise once a year. You continually have to monitor your vendor mix and make sure that you're doing everything that is mitigating any risks. So we kind of went over that. So Paul and I literally only have 40 minutes combined, so I can only really hit on some of the high level topics. But I picked out a lot of questions that I get are due to what language needs to be in contracts. And so I kind of focused a little bit on the contract language. The biggest thing is, again, having a BAA is not enough. That does not end your contractual obligations. You really need to have a master service agreement that's defining what you want to see. And the biggest thing I can point out is a right to audit clause. You want to have in that contract that you, as Partners Healthcare or Dartmouth Hitchcock, you want to make sure that you have the ability, from an internal audit standpoint, that you can actually make a site visit to this vendor and audit their environment against the HIPAA security standards and ask some very detailed due diligence. And a lot of the folks I talk to have that in, but what they don't have in is a remediation clause, where, okay, you have the right to audit, but what are they going to do to fix the findings that you find? So if you do have a right to audit clause, you really want to have that remediation clause in there as well. The thing that I want to focus on are the type of documents, because sometimes there's some confusion. So if you're doing an EMR vendor selection, or any type of SaaS or hosting vendor that's going to be housing your information, you want to ask for their SOC audit. So that's the Service Organization Controls Audit. As everyone in here knows, there is no such thing as a HIPAA stamp. Anytime that I go in and perform a HIPAA security audit, it's a gap assessment. We're looking at where someone is now versus where the HIPAA NIST 853 guidelines and frameworks say they need to be. But that's not an attestation audit, like a financial audit, like Deloitte and Touche coming in and performing an attestation financial report. But a SOC audit is. So, if you were, looking at Nuance, which has their eScription product, based on the Dragon speech technology, the first thing you want to do is ask for Nuance SOC audit. So that is going to validate that someone like Wolf & Company or another public CPA firm is putting on their letterhead that as of this day, we are attesting that Nuance is following the SOC criteria, and that report has a lot more weight than a HIPAA gap analysis. So anytime, and it doesn't have to be healthcare specific, if you're a software company that's housing someone's data, you need to have a SOC 2 report. So as a covered entity, as you're looking at your vendors, if they don't have it, or if they're pointing you to their data center, their data center's SOC 2 audit, or they're pointing to AWS's SOC audit, that's a big red flag, because AWS's SOC audit, or a brick and mortar data center, that's only speaking to the physical security of those servers that they're housing. So, but that's not speaking to the logical security of the application itself. You want to be asking for their pen testing reports. They're redacted, of course. No one's going to flip you their unsanitized pen testing reports. But you want to validate that a reputable penetration tester is, especially from the application side, you want to make sure that they've had application pen tests, that someone has literally crawled through that application looking for SQL injections, looking for cross-site scripting, buffer overflow attacks, all these high-level hacking techniques, because these applications are web-facing. Anyone can get to them and can bang away at them for an endless amount of time. And you see a lot of breaches happening with these type of web-facing applications. PCI DSS, so that's the payment card industry data security standards. A lot of EMRs now have the capability of processing payments and taking credit cards. So if there are any credit card functionality within the application you're looking at with the specific vendor, you want to make sure that they've gone through and had an attestation on it, where they would have a qualified security assessor validating that they're PCI compliant. Again, their business continuity planning. What are they going to do if they had a big incident? If they have a natural disaster, do they have warm sites, hot sites that they're going to be able to recover their data and still give you access to the information that you need? You want to see that they have disaster recovery testing and that they've performed the testing. You are within your rights to ask these vendors for these type of reports, so that that they're spending money and that they're doing all they can do to make sure that their application is secure. You also want to make sure, and this is a keynote, and it really refers to business associate agreements and the omnibus final rule. Are they using subcontractors? So when you're dealing with XYZ vendor, where is their development team? Is it in India? Is it in some other country? Well, what are the controls around those offices? So you really want to push and see that, who are you dealing with? Because it's that important. Again, they're holding the keys to the castle. And if a breach emanates, you're both going to be, the OCR is going to be looking at both sides. And if you didn't do the proper due diligence, you're going to be cited for it. Having termination clauses, and again, an annual review of their internal audit. So you just want to make sure, you want to have a process in place. Obviously, not everyone can have a vendor management full-time person, doing this, but someone within, usually like to see it in the compliance risk group, but if it has to be in the IT group or the security group, someone has to wear that hat. And you want to, they don't have to wear it alone. You can bring in, you want to make sure you're bringing in security, risk, compliance, but you definitely want to make sure you have a process in place to be performing ongoing monitoring. Again, you don't have to get into the in-depth NIST model of risk assessments. You just want to make sure you're designating these vendors high, moderate, and low from a risk perspective. Again, it should be a continuous process. And like I said, understand the supply chain. You want to make sure that you know where their folks are located, where their data centers are located. A lot of these software companies have, international development offices, and their security standards are sometimes far less than the corporate office. And again, you want to include the business lines in the vendor management process, making sure information security is involved, making sure application managers are involved, helping fill out those risk assessments for you. And making sure if you do have a risk management group, making sure that they're overseeing the whole process. So I wanted to drill down a little bit because into a SOC report. I still get a lot of confusing questions about it. What is it? Is it a federal regulation? Is it a state mandate? It isn't. It's an industry standard. But over the last 3 years, it's really gained traction. So if you're a SaaS provider, I would be shocked that you have not seen in contracts already from big hospitals and payer companies that they want you to produce a SOC 2. And it's a fairly long and detailed process. So. From a covered entity standpoint, again, this is the strongest report you can obtain. It's a CPA firm stamping on their letterhead that they're attesting that as of this day, that vendor is following the standard. There are 5 principles for a SOC 2 audit. Security, availability, process integrity, confidentiality, and privacy. About 90% of the SOC 2 audits that I run are based on security and availability. Because that's what we want to know, right? How secure is my information and how available is it going to be? So literally the standards are about 6 inches deep in terms of the set of controls that we're looking at. So when I go in to perform a SOC 2 audit at a vendor, typically on site for 3 months, we're looking at we're asking for very detailed levels of control. And unlike a gap assessment, we need to see proof. We have to see that the control is operating and effective. So that's where the weight of the report really comes in. So it's valuable on both sides of the fence. From a covered entity standpoint, it's a report that from an independent third party that's giving an opinion regarding the provider's controls. And also, it's a report that can include both the HIPAA and SOC controls. We actually started a few years ago including the NIST 800-66 special publication into the SOC controls itself. So even though there isn't a HIPAA stamp with a SOC audit, it's an actual opinion letter where the HIPAA guidelines were included. And for the business associates, you know, I hear it all the time, it really starts to help deflect those annoying security questionnaires that you get. If you're a security vendor, you're literally getting those on a weekly basis, and they can be overwhelming. With the SOC 2 audit, you can, you know, you don't have to answer those questionnaires, because you can produce this report that's going to, you know, cover anything that anyone would be worried about. That's it. You know, again, it can be hard to get the process started, but it's low-hanging fruit. It's something that you can do. I mean, I still go into very large hospitals that will be doing the audit, and we'll be like, well, we ran across this, and you know, we were talking to one of the business line owners, and we ran into this vendor, and we're talking to the chief security officer, the chief risk officer, and they didn't know that they had this vendor that had permanent access into the network. You know, and it's really not acceptable at this stage of the game. It's literally just going through and taking an inventory of who your vendors are, making sure that you're getting the proper due diligence documents, and starting to have that process mature. So with that, I will hand it off to Paul, who will be talking about remote access.
Awesome. Okay. Last presentation of the day. So make you all happy that way, I guess, if nothing else. Enjoy that part of the presentation. So, my name is Paul Chminsky. I've been with Citrix now just a couple months. So prior to that, I was working hospital down in Connecticut, running the infrastructure down there. So up until recently, felt most of your pain. So I took this slide. I really liked it it was from another presentation altogether, a ShareFile presentation. I was trying to show that struggle between IT and corporate and trying to stay compliant and the end user, the demands that the end user has. So all the end users now, especially with mobility out there and everything else, they want this application access from anywhere. They're more demanding now than they ever were before. And they were pretty demanding before, so that's actually saying something. But the data access and the application access from everywhere you're at. So those are constant battles that the end user is trying to get to, which is a lot of you in the room. And on the IT side, you're trying to maintain your security and your compliance. So you're trying to balance that too. You're a constant battle with each other on that type of thing. So you're going back and forth, and you're trying to find that happy balance. The other thing users want, they want it to be easy. I mean, when you go now and you download apps on your mobile devices today, it's easy. It's almost instant how you can learn and figure it out. So it's got to be easy and familiar. And I always argue in IT, on our side, it's also up to us to provide that great experience. You can put the best tools out there, but if they're not being used and not being used properly, if it's not a good experience for the user, it's not going to do what it's meant to do. So. To get these things done, to get this balance, to get this control and the security, and to keep the users in their demand of where they're at. These users, by the way, that used to rely on IT for security, now they're coming to us, and they're more technically advanced than your corporate IT is today. It's a constant battle. That used to be drove the other way. It used to be IT that was giving you the technology, and you go to work and figure it out. So to maintain this balance, you need to do a few things. You need to control the access, you need to control the data, and you need to control the devices. So those are three main things you really need to do. So to meet those demands, we're talking about secure data sharing. So you have to control the data. This is, in your typical old environment, you might have had, you sat at your workstation in your office, and maybe you went home, maybe you went to the laptop and accessed that way. So your old Windows devices had their little shares that they could access, and they're set up that way. Well, now with the mobile devices that work from anywhere, that work from the home, the office, the car, in between meetings, you're accessing information, all this type of thing, You need to take that up a level. It's no longer just the PC shit. I need to be able to get to it from the beach and Dunkin' Donuts and everywhere else I got to get to. So you need that central repository. And what it's going to help you do is keep those users from emailing out or personal file shares or sending that, distributing that information out in so many ways. You have multiple copies when you do that. You're going to have uncontrolled copies. If I send it to a Dropbox type thing, you as the IT corporation, you don't own that data anymore. You have no control. It's not accessible. It's not honorable. You've now lost it. So you need to provide tools that help provide that for them. The devices have changed. So again, we're no longer the PC in the office. We're the iPad, we're the smartphone, or the Chromebook, or wherever you might be accessing them, as well as that same desktop experience in the office. And you have to be able to control them all. You had extensive controls in the internal environment already. You had encryption on your laptop in case somebody walked out of it. You had Active Directory. You had all these controls in place. You now need to get control of that device, that iPad that everyone's using. And you need to find a way to isolate it, to keep it separate from the personal data. On secure remote access, so this is something probably you're already using. If you're using virtual desktop application and desktop delivery type of products like a Citrix app, these are products you're already familiar with. And what it does, besides controlling that access and giving certain people, you get the consistent look and feel. So when I sit at that laptop and I access that application, or if I do it from that iPad remotely or wherever I do it from, it's got a very similar look and feel. It's always very, very similar. And the products today, they've gotten to the point where they realize when you're working on a device, you're working on your desktop, you switch over to your iPad, and it's going to realize that you're going to drive that same exact session you're working on, and it'll know that you're now on a touch-enabled device, and you'll be able to utilize those touch features, and such like that. And even with them now, you can, with like a Citrix product, you can use a mouse on your iPad. So you even got that, with a Bluetooth keyboard and a mouse and an iPad, you look like you're working at a little mini workstation. So it's all there now. So that consistency, again, it's important. The tool's got to be something they want to use. So, and on the other part of those deliveries, you're going to get more uptime, more accessibility. You invested all this money in an EMR product, or you invested all this money in the PAC system. You want it to be up as consistent as possible. And these are going to help you do that on the back end. The end user's clicking on an icon, not realizing what's going on back there, and it'll help with that. So, secure remote access, and this is what I was talking about, that virtual application and desktop. So here are probably some of the use cases as to why you put it into. I mentioned the EMR deployment. Most of you, if you use Citrix for your EMR, you probably use Epic will tell you to use that app, or Cerner hosted back in Kansas City. They're going to have you access it through that app or virtual desktop and app virtualization. There's plenty of other reasons too. We talked to them earlier, so they're going to be a big user of this product. These are things you're using already. IT consolidation with all the hospital buyouts. If you're the end user, you're just clicking on an icon. You don't care that it's sitting in hospital A and not in hospital B. They're all right there for you to access, make it easy for the end user. You need the right tools to make that happen. And IT as a service, I know before I left where I was, we were looking at community hosting the Epic application, and you need a way to deliver it. The device. So device management, this is your mobile devices. These are going to be beyond the traditional Windows desktops and laptops you're managing. So your iPads, your smartphones, your Android users. So MDM was a big term up until a couple of years ago, still is, but it's kind of evolved. It's the evolution of MDM is EMM. It's not just securing the device, but the application and the access to that device. So what we're talking about is the amount of mobility going on. And if you're going to be accessing corporate data on a device, whether it be a corporate device or a personal device, whatever it be, you need to have control. So you need to containerize it. You need to take that application that's corporate, and you need to make sure that I can't copy and paste information down. I can't download information from my personal device. I need to maintain that control. when you lose that device, when you misplace it, it gets stolen, whatever, I can easily, remotely, from a central location, revoke that. You can't get into that easily. I can make controls like ping controls, or make sure there's basic security, so nobody can just walk up, grab your phone, and look at sensitive information. So these are all different challenges that we face in the mobile world. Malware is another. If you're going to give people access to your corporate data and you don't control that device, how are they protecting against the malware? And all this leads to, if you don't give these tools, if you don't give a way for the user to do it, they're going to go back to the email, they're going to go back to the file sharing, personal. They're going to be spreading out all this data, and you have more opportunity, more chance to lose that data. So you get this data leakage potential. And that data leakage potential is where you're going to end up making the news. That's where PHI information may or may get out. It's going to be expensive. It's going to cost you money. You're going to have to address the technical problems that made it happen. You're going to be doing it reactively instead of thinking it out. There's going to be fines. There's going to be lost revenue, and most importantly, the reputation. The reputation is going to be hurt, and how long that takes to rebuild. So again, you want to provide the right tools. And I like these stats, and the reason why I put it up there, 61, this one 2014, so it's a year old, which in technology terms is ancient. So 61% of information workers now work outside the office. Almost 2 out of 3 of us today are going to be accessing that information remotely. So you need to address it. You need to find a way. 72% of employees do not feel equipped with technology necessary to get their jobs done. And this leads to that database. They're going to find a way. If you don't provide the tool, your user will find a way to share that information out there. And it's, again, you lose that control. It's no longer yours. It's no longer auditable. It's no longer reportable. And the last one is the scariest. Is 67% of technology decision makers say the lack of data protection capabilities on mobile devices concerns them. So if your guys that do this every day are concerned, and that many of them that big, they need to have the tools to provide the users with right access as well. So I mentioned a little bit the MDM and how it's evolved to the EMM, and then going beyond that, even on your iPad, I mentioned that already, where you can remotely access beyond just the EMM and use the virtual delivery applications on those mobile devices as well. And you kind of want those, as much as possible, you want those to work together so you have a complete solution going on. Gartner defined an EMM saying that in their definition, content management had to include secure container, secure push, and secure container, content push, and content access. And that's what I was talking about, that sandbox, keeping things separate. You definitely want to keep your personal and your corporate data apart from each other and complete control over that corporate data. So the last part of what I mentioned would be the secure data sharing. And on secure data sharing, we're talking about EFSX, another great acronym. So enterprise file sync and sharing. And here's some of the requirements you're going to need to do this. This is taking Dropbox that everybody used at home for whatever reason to share pictures and files with each other. And this is bringing it into the corporate world and securing it down. So this is another part of the tool sets that you need. So secure IT oversight is definitely the most important. It's a secure transfer of data. I can control who gets to download it, when they get to download it, how long they get to download it for. It's one single repository, and then so therefore it's auditable, it's reportable. It's really the biggest part of those 5 right there. So the flexibility is that second one there. So I can store this. You already flexibility and the ability to integrate, so the 2 of them here. You already have all these files and all this data and this information. You already have an investment in that storage. This is now taking it and making that even more flexible. So we can now have we can have on-premise storage of this device, cloud, back and forth, combination, however you want to do it. So it's really flexible to do it. And again, now it's accessible from all the different laptops, workstations, mobile devices, anywhere that you're at. The rich content experience from before there really speaks to what we're talking about, the quick adoption. It's got to be easy to use. Again, if you give them a tool and if it's too hard to use, it's not going to be used and it's ineffective. first PowerPoint presentation together, so all those little features. So you have up here, you have your tools for each part. The controlling the access, we're talking virtual app desktop delivery. That's the familiar Citrix product that you might see. The Zen app, Zen desktop. Controlling the device, the EMM. And here are the different tool sets that they do for you. You have virtual application desktop delivery, Windows application migration. So if you're going Windows 7 to Windows 8 or to 10 now, that's going to help you get there. Those kind of tools are all in there. And the other part of these that are important is the integrated WAN. WAN's a wide area network connecting from outside your local environment. These protocols are built to optimize that connection and that experience. So they're very, very important tools in the tool set. And then the last part there is control the data. So that's the EFSS again. So those are all big items that you need. So if you remember nothing else from the presentation, the whole point I really was trying to make is you have to provide the tools. You have to give IT the tool set to provide to the users. Otherwise, you cannot control that data. You don't own that data. And it's possible with the right strategy to do this to make it a secure and make it a better user experience. And again, if it's not easy, they're not going to use it. That is all I have for the last presentation today.
Any questions for
Myself or
Mike's good.
Mike's gone?
Mike cleared out.
I can make something up for this stuff.
Where does training fit into all this, not just for the employees, but say for the VAs that come on site? Because I know like when I worked at the health center, some of the vendors you work with, they're really large groups. You don't always know who's going to just stroll through the door and show up into your patient area to fix whatever it is they're going to fix.
So training as far as what Mike was talking about, what I was talking about, or?
Either.
Either.
Well, he's not here, so I guess you can't answer.
All right, so the heck with this stuff. So, training support with anything you implement. When you put your EMR in, if anyone's, I went through a recent Epic one, so maybe I keep referring back to Epic. The amount of training that goes into something like that for the end user and everything else. Same thing with a tool like this. There's a lot of it to go. There's a lot that's going on. Most of that training is going to be for your IT staff. It's how you set it up in the back end. It's how you do it every year. But there's going to be that required end of the user. You want to make sure you have the documentation, or you have to. You want to make it again. You got to make it easy. So yeah, training like anything is important. Yes, sir.
So, sorry, I work with Paul, so I can probably help answer that question as well. We talked about the access controls and the different mechanisms that are in place. Part of that can also include policies that have to be completed before you grant that access. So a lot of times you'll see first-time user get a splash screen that says, hey, I agree to the terms and conditions. You can do that every single time a vendor badges in or signs into the environment. If they don't do that, you don't grant them access. If they haven't completed it in 30 days, so it's been 30 days since the last time they came on site, you can force that to happen because it's a policy. You can also show on the back end how many times that policy has been touched, how many times it's been breached, and how many times it's passed through. So when it comes time for the auditors, and I'll kind of speak for Mike because I used to have his job back in the day, or a similar job, and that's the stuff that the auditors want to be able to see because it's referenceable proof that the audit control is working. Not only is it designed properly, but it's also effective. So you can force someone to go through training, you can force them to do that every single time as they're granting access. It can be done through a variety of different ways, but the best thing to do is to have it when they access your system, whether it be on your network or via your application, periodically give them information. And then you can also, if you apply, say for instance, you put out a new feature and you want to make sure everyone gets trained on that, you can actually force them to go through some training, refer them to a link, and then until they click through that link, it then prevents them from getting onto the system. So there's tools now available, as we were talking about, to help enable that. And we can't force people to take the training, but you can certainly prevent them from doing things until they've completed it.
Okay, any more questions? Thank you.
Thank you. Okay, so it's since all of you stayed for the Friends of Conference session, as Mike called it, you get to participate in the raffle. Because we all want to be fit, right? Right. So did everybody put in